Snake venom varies depending on the species of the snake, and that is why they usually ask one that has been bitten by a snake the type of snake that bites you or the color of the snake so that they can know the treatment, the particular antivenom they will use on the person, because this venom varies. Because you have the one that damage the brain, you have the one that damage the heart, you have the one that damage the cell, you have the one that damage the muscle. That's why this question is necessary. In this video, I'm gonna list the type of venom. But there are snakes that can produce venom, a mixture of venom, complex venom. Complex venom, I mean, is that it contains venom that acts on brain, that damage the brain, also damage the heart, also damage the muscle, also damage the tissue and cell. So that's a complex mixture. So in this video, I'm gonna explain it very clearly. Type of snake venom are neurotoxic venom, the one that damage the brain and other parts of nervous system. And another one is hemotoxic venom, the one that damage the heart and blood vessel. Next is myotoxic venom, the one that damage tissue muscle. This one can cause kidney failure, muscle weakness. And another one is cytotoxic venom, which can cause bleeding, the destruction of cell, it damage the cell. And again, there is cardiotoxic venom, the one that has the same effect as that of hemotoxic venom. Both of them damage the heart, the cardiovascular system, and blood vessel. They have almost the same effect. Also, there is complex venom. This one contains a mixture of different venom. It may contain cytotoxic venom, myotoxic venom, and neurotoxic venom, or neurotoxic venom and cytotoxic venom and hemotoxic venom. So that is a complex mixture of venom. So let me explain it one by one. Neurotoxic venom affects the nervous system. It interferes with transmission of impulses at the neuromuscular junction. This venom, this neurotoxic venom, block acetylcholine receptors or prevent acetylcholine release. This leads to muscle weakness and paralysis. Clinical effects are drooping eyelid, difficulty speaking and swallowing, and respiratory muscle paralysis, which can cause death. Example of snake with this type of venom are cobra, mamba, coral snakes, king cobra, sea snake, and crate. Hemotoxic venom. This hemotoxic venom primarily affects the blood and cardiovascular system, that is the heart and the blood vessel. Normally, it destroys red blood cells. It damages blood vessel wall and also disrupts blood clotting mechanism. Clinical effects of this hemotoxic venom are internal and external bleeding, swelling and pain, shock and organ damage. Example of snake with this type of venom are adder, vipers, that is ev, the one we call ev in Igbo language, rattlesnake, puff adder, and roses vipers. Myotoxic venom. This myotoxic venom acts on muscle tissue. It causes the breakdown of muscle cell, which causes the release of muscle protein into the bloodstream. Clinical effects of this mycotoxic venom are severe muscle pain, muscle weakness, and kidney failure due to muscle breakdown product. Snake with this type are tiger snake, that is some Australian elapid, and sea snakes. Cytotoxic venom. This cytotoxic venom affects the local tissue at the site of the bite. It causes direct destruction of cell and reduce blood supply to the tissue. Clinical effects are severe swelling, blistering and tissue necrosis, and possible limb loss. Example of snake with this type of venom are adder, cobra, some vipers, and splitting cobra. Cardiotoxic venom. This cardiotoxic venom affects the heart, which causes irregular heartbeat and cardiac arrest. Example of snake with this type of venom, this cardiotoxic venom, are cobra and black mamba. Mixed or complex venom. This is a combination of two or more type of venom. For example, in cobra have three type of venom. Cobra venom contain neurotoxic, cardiotoxic, and cytotoxic venom. That's three venom. And in rosal viper, there is hemotoxic venom and cytotoxic venom. So it contains two venom type. So this is a mixture. From what I just explained now, you can infer that these venoms have different mechanism of action. They act in different places. One acts in the brain and other parts of nervous system. One acts in heart, in the cell, other acts in cell, in the muscle, and so on. So they have different places and different mechanism of action. That is why it is necessary to know the type of snake that bites you, the color, so that the people, the healthcare provider, will know the kind of antivenom they will give you. So that's the importance. Thank you for watching. Thank you for listening. See you next day.